Northwest has a full-service department. We have all modalities available. We have X-ray. I think most people are most familiar with X-rays in regards to chest X-rays. We have CT scan, MRI, ultrasound, nuclear medicine, and interventional radiology. We use X-rays very frequently in our department. The advantage of X-rays is that they're very quickly done. They're can be used for adults, children, and can answer a lot of questions, particularly if you come to the ER and have a broken bone. An X-ray can be used to very quickly, within a matter of minutes, determine if there's a fracture. So X-rays are very commonly used. The next modality that we would use would be CT in the evaluation of someone coming to the emergency room. CT stands for computed tomography. And what that is when you have X-rays and you put it together with a computer. So what the machine then does is, using X-ray energy and computers, to create a 2D image of your body. So what happens is you get exquisite detail of the anatomy, and it's almost as if you're looking into the patient, into somebody. You can see the organs within your abdomen, your liver, your spleen, and your bowel. So it's quite useful and very helpful. Other modalities that we have here at Northwest Medical Center is MRI. MRI is different from X-ray in that it doesn't use radiation. What MRI is, it involves using a magnetic field. Well, let me just back up just a little bit. What MRI stands for is magnetic resonance, and some people use imaging as part of the term. So MRI stands for magnetic resonance imaging. What that involves is putting a patient into a magnetic field, which is essentially a big tube with a very strong magnet attached. And then we use radio frequency waves to put energy into the tissues that we're going to be looking at. What that does is it allows us to have exquisite detail of the anatomy, differentiating muscle from bone, from a tumor, to an infection. So that's the advantage of MRI. It allows us great tissue differentiation. And another big advantage is that it doesn't use radiation for evaluation of the tissues. One other modality that we use very frequently here at Northwest Medical Center is ultrasound. And what ultrasound is super high frequency sound waves that is used to, with a transducer, which is a small probe device that goes onto your skin, and the sound waves then are transmitted through the tissue and then bounce back to the transducer, and then a computer generates those images. Big advantage here is that we don't use radiation, it's sound waves. So ultrasound is very useful in the evaluation of children and also for obstetrics. So those are very common tests that we use where ultrasound is used.